next, but we have got a very good speaker. We have got Bert Johnson, who's going to present on the voice of family members of those who have got mental illness.
Can you find my stuff? Okay, what do I do to make it go?
You can use this one.
Well, good morning, ladies and gentlemen, and it is a privilege for me to be able to address the conference, and I want to focus on the voice of family members in the whole spectrum and the whole corpus of interests in helping young people who suffer from mental illnesses. Just a couple of preliminary thoughts. Firstly, what I'm going to say is largely directed at clinicians and professionals. What I want to say is that you people should acknowledge the role of parents and families and make the best of it. I do not want to get involved about bad parenting and harsh parenting and so many of the ills of the world attributable to bad parents. I mean, I have to leave that on one side. And I don't have an answer to it anyway, and I don't know that anybody does what constitutes harsh parenting or violence in the home and its links to mental illness. So I would rather leave all that on one side, and I want to focus on the normal family, which gives a broad spectrum of people who have children and try and bring them up according to the best way that their culture, their habits allow them to. So that's the first point. Second point is continuity. Continuity, psychopathology, and continuity of care. And I want to show that when it comes to continuity, the family is quintessentially right at the heart of continuity. It's the family where young people are brought up. They go to school, they see professional clinicians, they have their own culture out in the streets and whatever activities. But the one continuous, permanent factor is the family. Again, I talk generally. I'm not talking about people who are homeless or whose parents are divorced and so on. I can't deal with those. I'm dealing with the mainstream of people, young people who are brought up in the normal standard family. And I know as much about fragmented families as anybody, but that's what we have to focus on, I think. I'm president of UFAMI. As I said yesterday, UFAMI is this mouthful of European Federation of Associations of Families of People with Mental Illness. And I'm very proud to be representing UFAMI. What I say actually is very much UFAMI's point of view, not just my own. Well, there you have it. It was founded in 1992 by a Dutch, Belgian lady called Gustav Frunix, inspirational a woman who said, well, look, we run a family outfit here in Brussels, and why don't we get together with all other family outfits? Because there was just a need by family members to help young people and indeed old people who overcome mental illness. Well, there we are. We are committed to improving the care and welfare of all people affected by mental illness, but particularly families and carers. What I want to assert to you, I hope persuasively, is that if we are going to make the best use of family members, point one, and if we're going to help family members, point two, then family members need to be fully integrated into the work of the professional clinicians. As I said, those are the people I'm aiming at, and policymakers, of course, in the diagnosis, treatment and care of young people showing signs of mental troubles is to be useful and effective. We had yesterday the discussion about Sturm und Drang and troubled genius, pop star or what have you? And is this just part of the phase of maturation, or is it indicative of something much more serious? Well, whether it's the one or the other, it's the family who is most likely to know, be the first institution, the first people to know what's going on, because the warning signs are likely to be the main provider of day-to-day care. So families are the first people to see warning signs. How they interpret them, of course, requires help. If we're talking about diagnosis, the most important information for establishing a diagnosis, as we know, comes from asking about the presence of symptoms. There are no blood tests for schizophrenia. There are no other scans or what have you. What are the symptoms? So we have these enormous surveys with statistical correlations, but why don't we just ask the people who know? If we don't have scientific tests, we rely on surveys and interviews, and those have to include the family members. And what I'm saying here are, what are some of the pointers that family would be aware of? What I've borrowed a phrase, I don't normally use this kind of language, diagnostically relevant symptomatology. I got that out of somewhere or other, I hope you like it. Anyway, you know what it means. What does it mean? Well, anyway, here are some. We've talked about them earlier in the conference. Genetic predisposition. Does it run in the family? And a lot about genetics yesterday. And I mean, I've known for half my lifetime that there is a case for thinking genetically about mental illness. Huh? I'm not saying it's the entire, I don't know much about genetics. It's not the whole story, but it's one factor. If there is some predisposition or some history in the family, that's something that families might be aware of. The clinicians don't know about that until somebody tells them. Neuropsychological damage, physical symptoms, poor coordination, delayed development milestones, clumsy child syndrome. I expect there are people in this room who've had children who were late developers, not just through the normal phasing of development, but because of some minimal brain damage which occurred, we heard yesterday, in the womb, postnatal. These can be factors which lead on to symptoms. And I think, too, I would relate that to victimization and bullying. If you're a clumsy child or you're behind in your speech and your coordination is delayed, then you may be more vulnerable to that sort of bad behavior. That will feed on itself, and you're more likely to end up with a mental illness than you otherwise would. Bad life experience. Again, we've heard a lot about that. Trauma we heard about this morning. Stress, deprivation, things like leaving home, migrants. In Britain, where I come from, we have this higher incidence of diagnosed mental illness, schizophrenia,